In the video about the healthiest vegetable in the world, I promised to tell you about the substances found in cabbage that have an anti-cancer effect. These substances protect our body cells from carcinogens. In simple words, there are substances or factors that increase the likelihood of malignant tumors. These are called carcinogens, and there are other special substances that can protect us from carcinogens. These include a large number of antioxidants, flavonoids, natural senolytics such as quercetin, resveratrol, genistein, fisetin, curcumin, and sulforaphane. It is about sulforaphane I want to tell you today. First, we will look at what sulforaphane is, what foods contain it, what positive effects it has on our body. Then we will look at precautions and contraindications. And at the end of the video, I will share with you a life hack on how you can activate sulforaphane and get the most of this substance from food. Yes, sulforaphane is found in food in an inactive form and it needs to be activated. Firstly, I warn you right away that you cannot use this video as consultation, medical advice, or a guide to action. You should consult a healthcare provider or a doctor professional for any health concerns. This video has been created for informational purposes. Sulforaphane is an amazing sulfur organic substance belonging to the class of isothiocyanates. In plants, sulforaphane is present in the form of a precursor, glucoraphanin. Under the action of a special enzyme, myrosinase, glucoraphanin is converted into sulforaphane. This enzyme is present in plant tissues or in the microbiome of mammals. In mammalian animals and humans, sulforaphane acts as an antioxidant and a potent stimulator of endogenous detoxifying enzymes. That is, sulforaphane activates detoxification enzymes and thereby provides protection of the body against carcinogens and toxic reactive oxygen species. Sulforaphane is present in all cruciferous, that is, cabbage plants, white cabbage, red cabbage, kale, broccoli, cauliflower, Brussels sprouts, Savoy cabbage, kohlrabi cabbage, leafy cabbage or aubergine cabbage, arugula, spinach, radishes, turnips, and watercress. But the greatest amount of sulforaphane is found in broccoli and broccoli sprouts. And the level of sulforaphane in broccoli is determined not only by the genotype of the plant, but also by the environmental conditions in which it grows. Moreover, most clinical studies have been conducted on broccoli sulforaphane, so I will talk about this particular sulforaphane. Broccoli is believed to have been domesticated in the 1500s, introduced to Great Britain in the early 1700s, and to the future United States in the late 1700s. However, broccoli was little known in the United States and the world until the 1920s. The first research into the protective properties of broccoli and the isolation of sulforaphane from it began in the 1990s. To date, there have been more than 3,000 publications on the efficacy of sulforaphane in rodent models of disease, and more than 50 clinical trials investigating pharmacokinetics, pharmacodynamics, and disease mitigation. A review of clinical trials published in 2019 includes a large amount of data on the high efficacy of broccoli sulforaphane in a wide variety of diseases. In particular, aflatoxin levels from corn and peanut seeds were elevated in China's Guidong province near Shanghai. Some scientists have linked this to a high incidence of liver cancer. Broccoli sprouts have been successfully used as a preventive agent in this region. The positive effects of broccoli have been noticed in asthma, atopic allergic reactions, and exposure to various air pollutants. The anti-inflammatory properties of sulforaphane exert changes in the joints, which favorably affects the course of arthritis. Broccoli sulforaphane has shown efficacy in patients with diabetes, insulin resistance, metabolic syndrome, and cardiovascular diseases. Patients with non-alcoholic fatty liver disease showed improvement in liver parameters, and patients with gastritis and Helicobacter pylori infection showed a reduction in Helicobacter pylori colonization and gastric inflammation. The anti-cancer activity of broccoli has been studied on many organs. For example, in 20 young men, 10 smokers and 10 non-smokers, the use of 200 grams of broccoli for just 10 days resulted in reduced DNA damage. It is exactly DNA damage that is associated with an increased risk of lung cancer. In the colorectal cancer risk reduction study, it was shown that consuming 250 grams of Brussels sprouts and broccoli per day can alter the metabolism of carcinogens found in red meat. Red meat consumption is associated with an increased risk of colorectal cancer, while consumption of cruciferous vegetables reduces the risk of cancer. Are you a fan of red meat? Do you eat it often? Write in the comments below. Some of you don't like to eat broccoli and might think that the easiest thing to do would be to buy a sulforaphane containing supplement instead of eating natural broccoli. But this is the opposite. When sulforaphane supplements are used at doses higher than therapeutic doses, burning sensations may occur along the back of the throat. High doses of sulforaphane result in adverse events, primarily nausea, heartburn, and other gastrointestinal disturbances. Consumption of sulforaphane from cruciferous plants is safe, of course, if you do not have individual intolerance and hypersensitivity to these food products. In addition to sulforaphane, you will get dietary fiber, nutrition for your gut microflora, and important nutrients, nutrition for your body in general. If we are talking about dietary supplements with sulforaphane, there are categories of people in whom the use of such products is limited due to lack of safety data. These are pregnant and lactating women, children, and people with seizure disorders. Such people should avoid taking sulforaphane supplements and include more cabbage plants in their daily diet. Let food be your medicine and not medicine be your food. Incorporate this concept into your life. Just think about it. A person eats about 60 tons of food in their lifetime. 60 tons. Does anyone think it doesn't matter what they consume? I promised I'd give you the life hacks to activate sulforaphane and get the most of it from food. So, first, the broccoli should be cooked using the blanching method, which is a technique to activate sulforaphane. Blanching is a short-term treatment of the product with boiling water or steam. That is, you literally immerse broccoli in boiling water for 2-3 minutes or dip them in boiling water or steam in a closed dish. Second, you can also add mustard seeds, thinly sliced turnips or radishes to fresh salads to increase the amount of natural sulforaphane, as well as frequent consumption of kale, watercress, arugula, spinach, leafy cabbage, white, red cabbage, and other cruciferous vegetables. Third, an important point. At the beginning of the video, I said that sulforaphane is present in plants in the form of a precursor, glucoraphanin. Now, glucoraphanin in plants is in an inactive form. The enzyme myrosinase is needed to activate glucoraphanin. This enzyme is found along with inactive glucoraphanin in plant tissue. And when the plant tissue breaks down, they begin their interaction, which results in the release of sulforaphane. And this process starts in the mouth when you bite and chew the plants. Chewing has to be done very carefully, and not only to get the largest amount of sulforaphane, but also to process the food with saliva and form food clumps, so that the enzymes of saliva had time to act on the food and thus facilitate the work of the gastrointestinal tract. Chewing should be done thoroughly so that you have time to savor the flavor of the food. In addition, long chewing will protect you from overeating because the signals of satiety will reach from a full stomach to the brain. My dears, chew thoroughly, consume more fresh cruciferous vegetables and be healthy. I wish you love and light. Your Dr. Zarifa Romanova.